For more than 2 years, they were among the most effective COVID-19 treatments.
That monoclonal antibody treatment can reduce the hospitalization risk if you are infected by over 70%.
But monoclonal antibodies are no more. The FDA pulled authorization for the final one last week.
So these new variants are called escape variants because they escape our immunity, and they really sort of escaped these antibody treatments that used to be previously effective.
9 News medical expert Dr. Pyle Coley says the old treatment just doesn't work. The lab-made antibodies used to bind to the virus, but they don't fit right on the new variants.
The antibodies are really no longer effective. They're no longer neutralizing or quenching the virus from making copies of itself.
It's a bad time to have one fewer tool in doctors' toolboxes. The CDC just pushed Boulder County's community COVID level back to high. It now joins 15 other Colorado counties with that rating.
With the holidays and the travel and the end of the year and all the gatherings that we're having, it's really setting us up for virus to spread itself very, very effectively.
Dr. Coley has bad news. She says it's time to start thinking about stopping the spread again. That means wearing masks more, testing frequently, and getting the booster shot, which helps against these new variants.
And if you're planning to get together or travel for Christmas or the few days before, now is the time to go and get boosted, because it takes, remember, 2 weeks after you get that booster to really get full protection.
Dr. Coley says there are still some treatments available if you get COVID-19. They're mostly antivirals, but you have to administer those super early in the infection for them to work, which requires you to test as soon as you might be sick and get a doctor's appointment fast.
Just don't want to get sick, so don't do it. Okay.
Exactly.
All right, be smart. Thanks, Cole.